We have an opportunity now because she's been emailing me for weeks. Facebook messages, Twitter messages, Instagram pictures, little signs that say, please, please, please. So Valerie Jarrett, senior advisor to President Obama, is joining us and as far as I know, Ms. Jarrett, this may be the first time you're on KFI.
It is the first time. Good morning, Gary.
You're
right. I wanted a chance to come on your show so I could tell everybody in your listening audience about the importance of signing up for the Affordable Care Act before the March 31st deadline.
Now, this Affordable Care Act that you speak of, I've never heard of it.
I find that hard to believe, but just in case it's true, it is an amazing new program that will ensure every American for the first time has the opportunity to buy affordable, quality health care. And all you have to do is to go on the website, which is in this area, it's coveredca.com, or you can call 1-800-300-1506 and look at the plans that are available in this marketplace and pick the one that's best for you and your family.
Let's talk about California, because I know that California, at least coveredca.com, has been a better example of success in terms of the website than an example even just to our north, Oregon, which just cannot seem to get itself out of a hole with that website. Has that been a problem? Nationwide, trying to make sure that everybody's up on the same page.
Well, I will say, as you know, the federal side had some challenges early on as well, but we're seeing progress across the country. Over 5.3 million people have signed up for coverage, and so it's working, 1 million in California alone. And so I encourage everybody to go on. Don't wait until March 31st either. Go on today and take advantage of it, because you don't want to wake up April 1st and suddenly you have an acute pain and you're on your way to the emergency room and you're thinking, oh, my goodness, what if I'd had health insurance? My visit would be covered, as opposed to the astronomical expenses you can run up on your own without health insurance.
Now, I know that the number 7 million is unofficial, but that was the number that was tossed around in terms of the desired number of people signing up to make sure that this thing was able to help pay for itself. Is that number even? You're close, like you said, 5.3 million. But are we going to get to 7 million?
The 7 wasn't our number to begin with. Our attitude is this: let's get as many people signed up as we can. We have seen increases in traffic over the last couple of weeks, serious increases in traffic, and people who've actually signed up. And so part of why I'm out in California today, and we have senior officials all over the country, is encouraging people to sign up. And you know, people tend to procrastinate until the last minute, and then they start to pay attention to the deadline, and that's what's happening right now. And so we are absolutely sure that we will have enough people who sign up to make the plan work, make it pay for itself. And to the families who are being touched by this, and you know, as a parent, I think all the parents out there, we know that if our children get sick, we want to make sure that we're not worrying about whether or not we can afford to take care of them. And in addition to that, now, there are benefits to the Affordable Care Act even if you do have insurance. So people with pre-existing conditions are now covered. Before, insurance companies could discriminate against them and drop them if you had a pre-existing condition. Women are entitled to preventive care, annual screenings for cancer, contraception without any copay. Young adults can stay on their insurance of their parents until they reach the age of 26. And so for those who don't have insurance, you can probably afford it for less than the amount of your monthly cell phone bill, as little as $100 a month. And so everyone should take advantage of this and make our country healthier by everyone having health insurance.
Now, I got to ask you, though, that the government wants, and I'll say the government, the administration, we're looking at, you got to have a certain number of people between 18 and 34 years old to pay for this. That's the healthy group that you don't expect to pay out for a lot of insurance costs for. And if they don't sign up, to me, not an expert, but to me, it seems like there's a possibility that this thing sort of implodes in on itself if we don't have enough healthy people signing up for this. Is that a possibility?
Well, we are very confident that we're going to have the number of young people necessary. And you've seen a lot of buzz lately when the president did Between Two Ferns, and we've seen a lot of these celebrity athletes who've been talking about it because, you know, athletes know firsthand that they can be young and healthy, and then one day they get injured and it costs an enormous amount of money. So I think we are very confident that we'll be on track with the number of young people in the pool necessary to make the plan work.
And what about the option, this is an option whether you take it or not, or whether you think it's a valid option or not, there's a lot of people who are simply going to say, I'm just going to go without it. I'm going to go without insurance. I'm going to pay the penalty, whatever it is, and I'm just going to do it my way. Whether it's a political protest, whether they don't think they need the insurance, whatever it is. Is there concern that number is too large?
No, as I said, when you look at the fact that over 5.3 have already signed up, and I think what happens is around the water cooler, around the kitchen table, people start sharing their experiences. And we are inundated with letters of people who signed up back in December, who received coverage, and who have been treated, and who had illnesses come up, who had accidents. You know, you never know when life is going to throw you a curveball. And so I think the word of mouth is going to be very important to seeing people, more and more people want to sign up as they start to hear about the advantages. Change is hard. Even change for the better is hard. But I think as people hear these stories, and let's face it, healthcare is very personal. Everybody has an experience with the healthcare system at some point. And then our message to young people is you're not invincible. We call them the young invincibles. They're not. And they never know when something is going to happen. And so we are confident that over time, more and more people are going to sign up. Before this deadline, we'll have another enrollment at the end of this year that will enable people to sign up next year. But my view is, why wait for that? You never know what's going to happen. Sign up now. And so that's why I wanted to come on your show, and that's why I was going after you in all kinds of ways, as you said in the introduction, to talk about this important new program.
Another personal question. Do you have a good plan?
I do. And you know what I think is important to keep in mind is that 85% of Americans have health insurance. And what we're trying to do right now in this enrollment period is to make it available for those who don't. And also, we try to strengthen the plan for those who do. So for the 85%, as I said, the insurance companies can't drop you if you have a pre-existing condition. Children can stay on their parents' plans until they're 26. There are no more lifetime caps. It used to be people with chronic illnesses, after receiving a certain amount of treatment, the insurance companies would cut them off and say, well, that's it. Well, that's not how illnesses work. They don't stop just because you've reached a cap. Now, so that's no longer a part of the law. And so there are many, many advantages to the health care plan for those who already have insurance, as I do, as well as for those who don't, who we're trying to encourage to sign up.
Well, I appreciate your time. I know you're busy because you got a lot of these lined up because you guys have some work still cut out for you. You know, you got
we do.
You got a week.
You know what? Every bit helps, and you're being able to speak to your audience is a very important part of meeting people where they are. So I appreciate you letting me come on, Gary. I wish you the best day, and hopefully your audience will go on that website today or call that phone number immediately, 1-800-300-1506, and get signed up.
Will you stop sending me Facebook messages now?
Now I will.
Okay.
But now you know I'm going to come back because I'm going to have something else I want to talk to you about. Well. So, but for right now, till the end of the month, it's ACA.
All right. I appreciate it. Again,
you're welcome.
Valerie Jarrett there, Senior Advisor to President Obama. And again, it's covered CA, healthcare.gov.